According to the World Health Organization, it is estimated that at least 1.2 million cases of meningitis occur yearly, with 1 in 10 people succumbing to the illness despite the treatment. The day was started in 2009 by a community of people affected by the disease, and today it is a global movement aiming to combat the ailment. But first, what is meningitis?
If in any case the cerebral spinal fluid gets into contact with germs, the microorganisms, the bacteria, the viruses, the fungi, in any case it gets into contact with them, there'll be an inflammation. There'll be an infection, hence inflammation. So the infection will cause inflammation of the meninges.
Among the different types of meningitis, the highest global burden is seen with bacterial meningitis. The bacteria that cause meningitis are transmitted from person to person through sneezing, coughing, droplets of respiratory or throat secretions from carriers, or being in close contact with an infected person. At Kenyatta University, we meet James Mokua, a graduate of Kenyatta University and a victim of bacterial meningitis.
So I decided he should live in a
James contracted the disease in 2015 while sitting for an exam at Kisii University.
I was doing a mathematics paper. After 15 minutes, I heard that something has knocked me behind. Trying to look behind who has knocked me, I saw nobody. By the 20 minutes, the knocks were now becoming frequent and frequent. I could no longer even continue doing the exam. I just left the paper. Immediately I left home, I couldn't even open my eyes because the headache had become so severe and I couldn't want to see light at all.
Having no idea of what had befell him, he sought for painkillers, which he notes relieved his pain for a whole week, before being taken to TENWEK hospital upon being diagnosed with the disease.
By 2017, I couldn't even read. You could even give me a phone, I look at it, don't know what to do with it, I return it to you. But back in 2018, that's when my brain fully regenerated. That's when I started now asking for the documents. I could look at them and know exactly how it was.
James narrates how the illness affected him. He says that he contemplated quitting his studies as the illness had paralyzed him. The disease also drained his family financially as the medical cover he was using could not fully cater for his treatment.
Back in 2019, I came to APDK in Nairobi. Then I saw somebody who was coming from the Office for National Council with Disability was a working class. That is the one which made me to think, if that person can get out of office, means he learned, then he was employed. Then I decided now, by 2018 September, I decided let me go back to school and try looking whether I will go back to school. Unfortunately, the environment in Kisii is hilly, no ramp, no nothing. The environment was very unfriendly. I googled Kenyatta University Disability Services. I found the contact of disability office. I called. Luckily, the woman who received my call, she's the one who mentored me and told me there are even worse people than you who are here learning. I can hear you are speaking good English.
We engaged Dr. Brenda Ogutu, who explains how one contracts the disease.
Meningitis is inflammation of the meninges.
According to Dr. Brenda, a study conducted in 2020 on the prevalence of meningitis in the country stands at 2.04%, with Kenya ranked number 19 among countries mostly affected globally. She advises the public, especially mothers, to have their children vaccinated, as well as seeking urgent medical attention in case of any detection.
If in any case the cerebral spinal fluid gets into contact with germs, the microorganisms, the bacteria, the viruses, the fungi, in any case it gets into contact with them, there'll be an inflammation. There'll be an infection, hence inflammation. So the infection will cause inflammation of the meninges.
The State Department of Public Health and Professional Standard Disease Surveillance and Response Unit under the Ministry of Health is also taking significant steps in the battle against meningitis. With support from WHO, the team has been working on the development of Kenya's National Meningitis Elimination Plan. Among the proposed pillars of the National Meningitis Elimination Plan include enhancing government ownership and securing financing for meningitis program, amplifying support and care for individuals affected by meningitis, and strengthening laboratory capabilities for precise diagnosis and addressing antimicrobial resistance. According to WHO, meningitis is one of the deadliest diseases globally. However, many have little or no knowledge concerning the illness. Therefore, doctors advise on seeking urgent medical advice in case of a symptom detection in order to prevent the disease. Julie Ongaki, KUTV.